heart attack versus cardiac arrest. Let's get something straight. With heart attack, you are experiencing coronary artery blockage. Oxygen is being deprived from reaching into the heart. Eventually, your heart or the muscle of the heart is going to go through something called myocardium ischemia or tissue necrosis. You feel chest pain that radiates to the neck, to the jaw, to your back, to your left arm. You also have nausea. You also vomit. You can also break into big sweats when you're having a heart attack. We put the patient on the EKG monitor. The patient is actually going to ST elevation, ST depression. The patient's troponin levels is up high. Now remember this, heart attack, your heart is beating, but it is slowly dying. So the patient is going to hypotension, and the patient is going to tachycardia. Hypotension for low blood pressure, tachycardia for high heart rate. Okay, we have to start treatment as soon as possible. Morphine, oxygen, nitroglycerin, aspirin. We do angioplasty. We do stent placements. We do thrombolysis. Cardiac arrest, on the other hand, your heart is malfunctioning. Your heart is stopped beating. It's no more pumping. Ventricular fibrillation, ventricular tachycardia, it can cause it. When we put the patient on the EKG monitor, we see the VFib, that is the ventricular fibrillation. We see the VT, that is the ventricular tachycardia. We can also see flatline, that means asystole. The patient collapses, no breathing, no pulse. The patient gets unconscious. The patient is actually not having good oxygen perfusing into the brain. It could cause you to have brain damage. In less than 6 to 10 minutes, a patient could have permanent brain damage. Eventually, cardiac arrest takes a lot of lives. Okay, we start treatment as soon as possible. High compression CPR. We actually defibrillate the ventricular fibrillation. We actually start epinephrine as soon as possible. We start amiodarone as soon as possible. We rush you to the ICU, that is the intensive care unit, as soon as possible. Remember, heart attack, you can make the call, you can get the help. Cardiac arrest, collapse, unconscious. EKG monitor, asystole, we shock you. We start epinephrine. We start amiodarone. Send you to the ICU. Care must begin because the patient can have permanent tissue damage or permanent brain damage. Eventually, the patient can die. Okay. Heart attack can lead to cardiac arrest. Now, cardiac arrest has a mind of its own. It just collapses the person, takes the person's life. So, great care must happen in both areas. Please pay attention to that.